A very good morning, everyone. My name is Zoe Bethany, Lyen, and today I will be presenting on the gastrointestinal system with a very special focus on the stomach, its anatomy, physiology, and the biochemistry, followed by a very common related disease, GERD, and finally an overview of the advanced technology in gastroenterology, specifically the robotic assisted GERD surgery using the Da Vinci system. So I chose this topic because it is both personally relevant and medically important. So, like many people, I've experienced digestive discomfort, such as bloating, indigestion, as well as abdominal discomfort. So, this actually made me very curious about how our digestive tract actually works and how disruption in a normal function can actually lead to disease. So, to begin with, I would like to briefly introduce our pioneer in gastroenterology, Dr. William Beaumont, who is actually the father of gastric physiology. So Dr. Beaumont is a U.S. Army surgeon in the early 1800s. His most significant contribution came from his unique opportunity to study about our digestion directly in the human body through gastric fistula in a patient named Alexis St. Martin. So throughout his experiment, Beaumont demonstrated that digestive is chemical, not just mechanical, highlighting the role of gastric juice, temperature, emotions, and the food that is consumed by humans. His work has laid a very strong foundation for the modern gastrointestinal physiology, and it would continue to influence the medical understanding for today. So now moving on to the anatomy of the stomach. The stomach is a J-shaped hollow muscular organ located in the upper left quadrant of the abdomen, just beneath the diaphragm. It acts as a transitional organ between the esophagus and the duodenum. It has a capacity approximately 1 to 2 liters in an adult. So anatomically, the stomach is divided into five main regions. So first of all is the cardia. Cardia is the area of the esophagus enters the stomach. Although it does not have a true anatomical sphincter, it contributes to an important anti-reflux mechanism, together with the lower esophageal sphincter. Next is the fundus. So the fundus is a dome-shaped region located superior to the cardia. It serves as a temporary storage area for food and swallowed air and allows the stomach to expand without a significant increase in pressure. So, moving on is the body. So, the body of the stomach is the largest region and is the primary site of acid and enzyme secretion. It plays a key role in mixing food with gastric juice to form chyme. So, distally, the stomach narrows into antrum, which has a very thick muscular wall. The antrum is very important for mechanical digestion and also to produce gastrin, a hormone that stimulates acid secretions and gastric motility. So finally, last but not least, we have the pylorus. So it is actually connected to the stomach and the duodenum. It connects the pyloric sphincter, which regulates the controlled release of chyme into the small intestines and prevents backflow. So based on the slide, it actually regulates gastric emptying. So histologically, so let's see the histology layers. The stomach wall actually contains four layers: the mucosa, submucosa, muscular and external, with its three unique muscle layers, and the serosa. So these structures are very important because they enable efficient digestion and mixing. So like the mucosa is important for secretion. The submucosa is important for vessels. It has vessels and Meissonier plexus. While the muscular external has three layers, while the serosa it's important for friction, protection and reduces friction. Okay, so moving on to the next part is the blood supply, innervation, and lymphatic drainage. So for the stomach, it has arteries and veins. The arteries are celiac trunk branches, while the veins are portal venous system. While for the innervation of it is parasympathetic, which is the vagus nerve, which increases the secretion and motility, while there's the sympathetic, which reduces the activity and vasoconstriction. So moving on, there's also the lymphatic drainage, which is the celiac lymph nodes. While the functional significance of the stomach is actually storage, chemical digestion, and control empty. Okay, so let's move on to the physiology of the stomach. So let's see the diagram. So the diagram illustrates the functional roles of the stomach, which is mainly food storage organ, and also as a mechanical digestion via the peristaltic contraction. So this means is that food is mixed with gastric digestion to form chyme. So next is the chemical digestion through gastric acid and enzyme. So chemical digestion is driven by the gastric juice. Parietal cells would secrete hydrochloric acids, which then activates the pepsinogen into pepsin to kill all the pathogens. So chief cell secretes pepsinogen, while mucous cells produce a protective mucus bicarbonate layer. So moving on. Last but not least is the regulation of the emptying of chyme into the duodenum. Into the duodenum under the neural and hormonal control. So the stomach activity is regulated by the neural and hormonal mechanism, so including the vagus nerve, gastrin, somatostatin, which ensures digestion occurs in a controlled and balanced manner. So moving on is the biochemistry of the stomach. So from a biochemistry perspective, the stomach plays a very crucial role in protein digestion. So first of all is the chief cells. So let's look at the chief cells. The chief cells would release pepsinogen and activate the enzyme, which is converted into pepsin in the presence of hydrochloric acid, which is secreted by the parietal cells. And pepsin is then breaks down protein into a smaller peptide. Mm. So moving on to the points here, another very important factor is also the intrinsic factor. So it is very important for the vitamin B12 absorption to the ileum. So overall, as a short, the gastric biochemistry involves a very delicate balance between acid and enzyme, as well as the protective mechanism to ensure effective digestion without any self-damage. Okay, so moving on. So like I mentioned just now, there's a disease that is related to our stomach, which is the most common one is GERD. So GERD is gastroesophageal reflux disease. In short, GERD. So GERD occurs when the lower esophageal sphincter becomes weak or relaxes inappropriately. So this allows the gastric juice to reflux into the esophagus. So unlike the stomach, the esophagus would actually lack a protective mucus barrier, so making it very vulnerable to acid injury. So as you can see in both of the pictures show. So what actually happens is that an individual would show the symptoms of heartburn, chest pain, and chronic cough, hoarseness. For very severe cases, they would show complication like esophagitis or Barrett's esophagus. Okay, so what actually causes this disease? So there are many lifestyle factors would actually cause, such as obesity, late meals, certain foods, or immediately lying down after eating would also cause GERD. By increasing the intra-abdominal pressure or reducing the LES tone. Well, as you can see at the picture on the most right here, so this is actually the advanced technology used for treatment for GERD. It is called the robot-assisted Nissin phonopolication using Da Vinci surgical robot. So in this procedure, it's how it works is that the upper part of the stomach is wrapped around the lower esophagus to strengthen the LES and prevent reflux to occur. So this robotic system actually allows the precision and it gives a magnified 3D view, allows the doctor to have a more clear view in the stomach and reduces the tremor during surgery. So the advantages are smaller incision, reduced postoperative pain, and lower any complication rates. And the individual would actually have a very would actually have a faster recovery. And this would also, and it is proven that it improves the long-term symptom control. Okay, so as a conclusion, this presentation actually highlights the integrated relationships between anatomy, physiology, biochemistry, and clinical disease within the gastrointestinal system. So I've discovered that the stomach not only serves as merely a storage organ, but it is actually a very highly regulated structure essential for digestion for food. So GERD demonstrates how disruption of normal physiology can lead to significant disease. While we are very lucky that we have modern technology like robotic surgery to show how medicine continues to evolve to improve the patient outcomes. So, as a summary, I believe that this topic has strengthened my understanding towards our digestive tract and towards my interest for gastrointestinal system. And this has made me more interested in pursuing in this field in the future. So that is all for my presentation. Thank you so much for your attention.